there, my name is Madison. I'm going to be your student nurse for today. Can I have you go ahead and verify your name and your date of birth for me?
Yes, it's Allie Mann and 3/27/2000.
Perfect. Thank you, Allie. I'm just going to go ahead and give you a little bit of privacy over here, and I'm going to wash my hands. So I see on my chart that we have you in here for a routine physical today. So I'm just going to go ahead and take care of that when the doctor will be in a minute to finish that up.
Okay.
All right, so are you okay with starting with your vitals today?
Mm-hmm.
All right, so I'm going to take your blood pressure, your heart rate, your respirations, your temperature, and your SpO2 level. Okay, so I'm going to go ahead and put this on your finger. It's just going to hang out for a little bit. Okay, and we're going to get your blood pressure. All right, so I'll flip this over. And I'll just have you hold this for a second for me. Actually, is that uncomfortable with that?
It's okay.
You're okay?
Yeah.
Okay. All right, your blood pressure is 119/78. Go ahead. I'm gonna help you hold that for a second. To the side, and I'll take this off here. Okay. And I'm gonna take your temperature really quick for you. 98.8, so no fever today. I'm gonna go ahead and read this off. Let's see, we have 98% oxygen saturation on room air. And go ahead and I'll check your pulse right here. Just gonna move this guy out of the way. Right. All right, so your heart rate was 68 and your respiration rate was 8. I'm gonna go ahead and I'm gonna chart that. And we're gonna continue on with the rest of the assessment if that's okay.
Mm-hmm.
All right, so are you in any kind of pain today?
My ankle has been hurting me.
Your ankle's been hurting you. Can you tell me when that's first started?
It started on Friday.
On Friday, okay, so about 2 days ago.
Mm-hmm.
And the location, is it your right or your left ankle?
My right ankle.
Right ankle,
Mm-hmm.
okay. And the duration, so that's been 2 full days that's been
Mm-hmm.
going on? Okay.
Yeah.
And how would you describe the pain?
It's dull until I put weight on it and then it's sharp.
Okay. Does anything alleviate it?
I've taken ibuprofen and that's helped.
Okay, and just not walking on it, that's been helping a little bit too?
Mm-hmm.
Okay. Does the pain radiate up your leg at all?
No, it doesn't.
Radiate? Okay. And the timing, is it intermittent or is it pretty consistent?
It's pretty constant.
Okay. And for severity, on a scale of 0 to 10, with 10 being the worst pain you could experience, how would you rank your pain?
A 3 out of 10 right now.
3 out of 10 right now? Okay. Well, we'll get that taken care of. I'm gonna go ahead and continue on here. So I'm looking at your general appearance, and you don't seem to be in acute distress at the moment, so that's a good thing. I'm seeing that your facial expressions are matching with your emotions that you're showing, and based on our conversations, I'm seeing that you're alert, awake, and oriented. Can I have you stand up really quick? And I'm just gonna have you take 3 steps this way and then 3 steps back. Okay. And I'm just watching your posture, your gait, and your motor activity and seeing your kind of comfort level there. I'm also looking at your appearance and your dress, and I'm not noticing anything abnormal or out of the ordinary there. You seem very healthy. So I'm going to continue on. We're going to start your cardiovascular assessment. All right. So as I was taking your respiration rate, I was noticing that you aren't using your accessory muscles to breathe, and it seemed to be very normal expansion when I was going through. So I'm just going to go ahead and I'm going to palpate the precordium over here. It's just going to be like this. And just feel free to breathe normal, whatever is comfortable for you. I'm going to do the same thing on the back here. And I'm not noticing any lifts, heaves, pulsations, or thrills to touch. I'm gonna go ahead and I'm gonna feel through your skin here. See if you're okay. Your skin is warm and dry. You don't appear to be diaphoretic right now, so that's good. I'm gonna go ahead and I'm going to auscultate. All right, so I'm just gonna be moving this back and forth across your chest. So with each lift, I'm gonna have you breathe in, deep breath in, and deep breath out. Okay, here we go. All right, and you're not feeling dizzy at all?
Nope.
Okay, I'm gonna come around to the back side here. I'm just gonna move your hair out of the way, and I'm gonna do the same thing. All right, thank you. And I'm going to go ahead and check for jugular vein distension. So I'm going to be looking along the back here. Okay, not noticing any distension. All right, and I'm going to go ahead and palpate your lymph nodes here real quick. Anterior, posterior, and just above the collarbone here. All right. And then can I have you swallow really quick for me, please? Thank you. Just feeling your trachea there. All right, now I'm gonna go ahead and listen to your heart sounds. All right, so with this, you can just breathe normal, whatever's comfortable for you. I'm just gonna be doing 5 spots, and then I'm gonna do your carotid arteries. And then for your carotid arteries, I'm just gonna have you hold your breath really quick. Thank you. And then I'm going to switch it to the bell and I'm going to hit those same points again. And feel free just to breathe normally, whatever's comfortable for you. Okay, and I'll have you hold your breath again here. Perfect. Thank you. All right, so do you have any history in your family of cardiovascular disease?
No, I don't.
Anything? And do you have a personal history?
No, I don't.
No? Okay. And then as far as your lungs, do you have any history of lung cancer or smoking in your family?
No history of smoking or lung cancer.
No history of smoking. Okay. And do you personally smoke?
I do not.
Do not. Okay. So we can go ahead and we can move on to your skin assessment here. So I'm assessing and I'm looking and I see that you don't have an IV, but if you did, I would be checking for erythema, swelling, and drainage. I'm visually looking over your skin and I'm not noticing any masses, lesions, any erythema or swelling, anything to cause concern at the moment. Do you personally have any concerns about your skin though, or notice any changes?
No, I haven't noticed any changes.
Any changes? Okay, that's good. I'm gonna go ahead and I'm gonna assess your capillary refill here. Go, less than 1 second, and your skin turgor. All right, I'm seeing that you aren't dehydrated, so that's good. And I don't notice any clubbing here as well. I'm gonna go ahead and I'm gonna do a Braden skin assessment. So that's assessing your activity, very active, and your nutrition levels, and your mobility, sensory perception, friction and shear, and moisture. And when I was palpating your skin before, I didn't notice any diaphoresis. And for your mobility, you're very active, nutrition, very healthy intake. So I'm going to go ahead and give you a 23 on the Braden scale. I'm going to go ahead and palpate your hair here. Just looking for lice, any kind of parasite, any texture or brittleness, which you don't, you have a beautiful head of hair. All right, so if you don't have any concerns, I'm gonna go ahead and move on to eyes, ears, nose, and throat assessment. So do you have you noticed any changes in your vision, in your hearing, your taste, or your smell?
No, I haven't.
You haven't, okay. Do you wear eyeglasses?
Only when I'm reading.
Only when you're reading, so not on a normal basis?
No.
Okay. And do you wear hearing aids?
No, I do not.
You do not, okay. So I am gonna go ahead and check your eyes here. So I'm just going to grab out my pen light. There we go. All right, so I'm gonna check your eyes here. So I'm gonna have you stare at that back wall. All right, I'm gonna do the same thing on this side. And looking at the other eye. All right, and then if I could just have you follow the end of this. Great. All right, so I'm gonna say that your pupils are equal, round, and reactive to light. And as I'm looking at your eyes, I'm not noticing any eyelid drooping. Your inner canthus looks healthy. I'm noticing that your sclera and your conjunctiva is white. Those are all good things. I'm gonna test your hearing over here. So can you hear this?
Yeah.
And how about on this side?
Yes.
Okay, take a look. Looking for cerumen, foreign bodies, erythema, drainage, otitis, nothing there. I'm looking for the same thing on this side. Nothing to note. And then palpate your nose here. Okay, and can I take a look at your nasal mucosa? Perfect. Okay, I'm not noticing any redness or inflammation. And can I have you say "ah" for me? Look. Okay, I'm looking at your tonsils. They're there, but they're not protruding, so I'm gonna say that they're grade 1. I'm looking at your dentition, your gums, your palate, your tongue, and I'm not noticing anything out of the ordinary there. So if you don't have any more questions, I think that is it for the day, and the doctor will be right in to help you up here.
Thank
So I'm gonna
you.
go ahead and wash my hands.
Just click it.